Welcome back, everybody. I'm Chris. This is Mike Saffy, Silverlink Consulting. This is our second segment of 7 Minutes for Seniors. Thanks for being here and having me to your house. I guess thanks for me being here at your
Thank you
house.
for being
There
here.
you go.
Absolutely.
So, second segment, a little bit more about Silverlink Consulting. So, we were leading into it in the first segment. So, how exactly do you help seniors?
Yeah. So, what we do at Silverlink is we help advise seniors and their families on long term care options. So, we have a bit of a process. We go into their house, we do a detailed assessment or wherever they call home. Some of our clients are in rehab at the time we help them, and maybe we're trying to figure out if they can go home or not still safely. So, we go to wherever they're at, do a detailed assessment. We go over their care needs, we go over their financial needs and help them create a budget. And then we also go over like a psychosocial type history with them to match them up to potential neighbors that they might have at a community to say, hey, you might like this community because it has X, Y, and Z.
Right.
So we give them all of that. We give them a community comparison report, which basically outlines what community options meet their criteria. That's all customized with our software system. And then after that, we go on a personalized tours with them. So we help them tour throughout the process, help get all the paperwork for their move-in. And then we also can help coordinate movers and anything else to get them transitioned.
Okay.
Yeah. Same way if they want to try it home for a while, we will, refer Chris, we'll refer you, and we'll refer maybe some in-home care, things like that. We can just kind of help them navigate that for when they are eventually ready to move.
Yeah.
Because there's some things that might preclude people from staying in their home at some point.
Right.
Yeah.
And we all only get old once.
That's true.
And if you got to practice at it, you'd probably be really good at it by the second or third time around. So that's why you need somebody that can help you reasonably look at the situation. Somebody not physically attached to the situation, because emotion can cloud a lot of decisions. Family is a blessing and a curse a lot of times, right?
Well, and not just family. I mean, even just the healthcare system throughout. Sometimes when you go from hospital to rehab to whatever the next step is, you get tons of friends, relatives, but also professionals that all will tell you what they think is best.
Right.
And I find that, I always have to ask, did they sit down with you the way we are?
Right.
Did they go through what your care needs are and talk to you in detail?
Yeah.
Because I would not make the same way that you wouldn't modify someone's house, for maybe if they have oxygen, for example, and maybe they're heavy smokers and have oxygen or emphysema issues, you would modify their house differently. You would be thinking about oxygen tanks and cords and things like that. It's not the same for somebody who might have a physical disability that's a fall risk.
Right. Exactly.
Different care plans.
Well, sometimes oxygen can actually make a new wider
trip over.
doorway to get into the bathroom.
Or it creates its own fall risk.
Yeah. I had a guy blow himself up. We kept telling him he was gonna, and he was a smoker.
Did he do the transition?
He forgot to take his nasal cannula off. And I got a phone call that morning. I was going to his house, and somebody was like, "Oh, the ambulance is here." And so then I went to see him like 2 months later, whenever he got out of the hospital in rehab, and the nasal cannula had melted to his face, and it went all the way around and up over his ears and down underneath his chin. He was a very dark-skinned man, and all of this was white and pink.
Scar tissue.
He called it his racing stripe. He called it his racing stripe until the day that he died.
I would call it a dragon scar. That's pretty cool.
But yeah, and we just kept telling him. And he just he blanked one time.
Yeah.
He said he got it in his mouth and went like this, and then it was just a fireball.
Oh my gosh.
Yeah.
Note to everyone at home, don't smoke with oxygen.
Do not smoke with oxygen. Don't smoke.
Yeah.
Don't smoke. If you do smoke, quit smoking.
That's right.
So who is Silverlink's ideal client? Paint me a picture.
We help a wider range of people. I mean, our ideal client really is going to be anybody that's 55 and over, because we do work with independent living communities as well, which is a whole kind of different bag of tricks. But anyone who is over 55 that really doesn't feel like they can live home alone anymore, or they just do not feel comfortable in their own home on a like a almost near 24/7 basis. So a
Right.
lot of our clients, like I said, if home care is an option, we talk them through it.
Mhm.
But in home care, like private duty care, we know is
Right.
expensive. So I always say there's this financial tipping point between what you're going to spend getting care at
Mhm.
home versus what's going to be done in assisted living.
Right.
And for some of our clients, that financial tipping point comes, we help them assess it and we give them the option. It's a very low pressure situation as long as they're safe at home,
Yeah.
you know. But then there's our independent clients who they just want to downsize. They don't want to maintain their house anymore. They
Yep.
don't want to worry about, did I pay the housekeeper? Did I pay the homeowner's insurance? Did I
Mhm.
pay the lawn maintenance? Did I, do all these things?
Right.
So they just want the convenience of still maybe even living in a residential house, like a
Mhm.
villa or something. But they want the convenience of having everything under one bill,
Yeah.
having the meals made for them, the housekeeping done, all of that in one section. So it really truly depends on each client.
So because you had the home care
Uh-huh.
and the consulting, do you have an idea of where that tipping point is? How many hours a day? Because we know that in-home care is like $32 an hour.
That's about the
Most
standard
agencies
average.
are 4 hour minimum.
Yes, sir.
So
Yep.
we're talking about $128 a day, right?
On average, if you
Right.
do the 4 hour minimum.
Right.
Now, most people don't. They will get more than that.
Right.
So it depends. I always say when you hit about 25 hours a week, that's going to be your tipping point.
Okay.
When you factor in all the other expenses, because you still have to maintain your house, you still have groceries, you still have everything else.
Yeah.
Yeah.
Yeah. So
Okay.
that makes sense. So 25 hours a week at $32 an hour, what does that work out to?
You're looking at about $4,500 a month. So when you get to
4,500 a month.
that point where you're spending anywhere between $3,500 and $4,500 a month on care,
Yeah.
I mean, when you factor in property taxes, if you still have a mortgage, that really
Right.
affects it. All the maintenance to your home, things like that, and groceries and
Yeah.
housekeeping. When you compare and contrast it, you're really looking at it at that point, at that
Right.
$3,500 mark or so.
Yeah.
Yeah.
Huh.
And then it becomes just a choice of convenience. Do I
Right.
want to spend this or do I not?
Right. Exactly. And just to tie a bow on that, from my perspective, when you have a caregiver coming in the home, um, they're there to assist with those tasks that you can't do anymore. When you go to an assisted or even an independent living facility, you can pick and choose the tasks that you need them to do,
Mm-hmm.
right?
Yeah,
So
customized care plan.
so a lot of times that level of independence can actually bump back up, because if somebody's helping you, you're not independent.
That's right.
Right? Just because you exist inside of your home doesn't mean you're independent. If somebody is helping you, like a kickstand, they're the one that's holding you up.
Mm-hmm.
So when you look at that situation, a lot of times these people will actually bump back up in their level of independence because something else is being taken care of for them that would normally be an obstacle in the home. Right?
Yeah, and that's another thing that we can talk about maybe in the next segment too, is how we help with like step down programs after someone is
You might as
recovering
well
from a
keep going,
stay.
because
Oh, okay.
it goes downhill from here.
Gotcha.
Yeah.
Yeah. So some of our clients that we help, it's not a long term placement. Some of our clients, because most of the communities we work with are month to month leases.
Right.
So you give a 30-day written notice, they're not going to hold you to the lease after 30 days.
Okay.
Some of our clients, like we're helping a gentleman right now. His wife just had a severe stroke, so we're really helping the wife. She is relearning how to walk. She's wheelchair bound.
Mm-hmm.
She's learning how to transfer because she's got an immobilized arm. So all of those things are just brand new to her.
Right.
So our goal is to get her to an assisted living, get her the physical therapy ongoing, and just continue to help her improve after that rehab stay.
Mm-hmm.
Because of course Medicare only covers so much.
Right.
And she'll stay there, we hope, for about 3 months, maybe a little longer. But once she meets some of those therapy goals,
Right.
she's hopefully will go home
Mm-hmm.
and be able to continue to do things at her home,
Right.
and as independently as possible.
Absolutely.
Yeah.
And to dispel any myths, gravity is exactly the same in your house where you sit right now watching this video as it is in the assisted living facilities.
That's right.
Okay. They don't turn the gravity dial down. So people still fall in those places,
Mhm.
especially if the space hasn't been set up properly.
That's true.
So you know, but it's still a safer environment because there is somebody there typically that's trained and has their hands on people when they are being mobilized. So, so that's why it's important. And yeah, I can't put a bow on the end of this. That'll be the end of our second segment. Thank you very much, folks. We'll be right back.